family-oriented, meaning we treat our employees and staff like family inside, and then we also treat our patients like family, and we mean that. I've given patients my cell phone so I can call them and talk to them. We've come in on after hours. I mean, it's just, we want to help people get better, and we want to stop, we want to help curb or reduce the opioid usage. That's a major problem going on, and the way we do that is by preventing people from ever having to get that prescription. And that's how we do that. 97% of the time, people come in and they go, my knee hurts and I was told it was bone on bone. Anybody ever heard bone on bone? We hear that one a lot, yeah. What we find is when we take an x-ray is they're bone on bone, but they're only bone on one side. The other side's still open, it has a lot of space. And so, if you stand up and your knee is sitting like this, does it make sense that you're going to put a lot more pressure on the side that doesn't have any space? So that's the side that's going to get damaged because you're putting a lot of pressure on it. And when it gets damaged, it hurts. So a majority of those 39 people were knees because if we get the knee to do this, it can heal. And if it heals, it doesn't hurt. And then they don't need knee replacement. Let's say somebody came in, like that person right there I just showed you on there, which you guys have these sheets as well. But we've got somebody sitting right here. This is, where am I? Bone on bone. This is bone on bone on this side. Do you see how the other side is not bone on bone? Mm-hmm. Okay, so on this person, what we would need to do is we would need to put what's called an offloading knee brace. The offloading knee brace would put pressure from this side to open that side. Okay? So it puts pressure on one side to open the other side. It offloads the pressure off of the other side. Okay, so we do an offloading knee brace. Number two is we would do injections inside the knee to open the space up. So we do this with the brace and this with the injection. Then we do mobility, chiropractic adjustments, and therapy to improve the strength, and voila, now the knee works properly. They don't need surgery.
And your injections are all natural?
The injections that we do, we have multiple different types. It just depends on what the patient needs. But we have a whole bunch of different options that we use. We do not do steroids, that's one that's off the table. Yeah. So the injection we do will depend on what the patient has had in the past and what the goal we have into the future. And everyone's different. What I tell people all the time is, when they go, hey, can you help my brother's knee? Can you help my whoever's knee? And I say, well, we help knees all the time. The only way for us to know is if you come in for a consultation, then we can figure out what exactly you have going on and what needs to be done to